Hello YouTubers, Joe Kersey here on Wednesday, September 24th at 3 in the afternoon Eastern Daylight Time. I thought I'd show you what basically keeps me alive here. I've mentioned in the past I have relatively severe hypertension, high blood pressure, and so I take a number of drugs for that. Atenolol, I take 100 of that a day, one of those a day. I take 300 of metoprolol a day. I take one of the 10 milligrams of amlodipine a day, and then 50 milligrams of hydrochlorothiazide. That's two of these little 25 milligram tablets that I happen to be using right now. And then the enalapril, I take 40 milligrams a day. Two 20 milligram tablets spaced out. I know it says 10, but that's just an old bottle. And then I take 3 grains of desiccated thyroid as complete thyroid replacement, because some point in the past I had thyroiditis, and it pretty much wiped out my thyroid, so I take replacement. Plus, when I was working, I was around a lot of radiation in my head and neck, you know, with an image intensifier, and I thought, well, let's just, you know, take the thyroid out of the picture so I don't get thyroid cancer. And occasionally I'll take propranolol, 40 milligrams every now and again. As the woman that came into the ER said, you know, just when I feels I need it. And that's always useful to have that on hand as a little bit of a backup. So that's what that and the grace of God keeps me alive, and a daily aspirin, and occasionally some ranitidine. Much as I would love to decry Big Pharma, and believe you me, they do rape people over with some of their pricing on the drugs. You know, these products have kept me alive. I started on the Inderal or the propranolol when I was 25. So I've been taking that 37 years. Or beta blockers anyway for 37 years. And then when the amlodipine came out, which was trade named Norvasc and made by Pfizer, you know, it's a calcium channel blocker. One of those dihydropyridine calcium channel blockers, and I was able to get it free from the drug company for about 3 years, and then they cut me off. That was when I was still, well, they still thought I was practicing. And I think the drug rep had a bit of pity on me, but they told her she had to cut me off, so then I had to buy it, you know, at market price, which was $2.60, later growing to $2.80 a tablet. Now, mind you, they were still selling the same drug in Spain for 25 cents a tablet. And I know, and you know daggone well they're not selling that drug in Spain at a loss. See, that's why I have a hard-on about these big drug companies, the way they price their drugs. They're just raping people, period. Yes, they're just raping you, period. Well, needless to say, when my dad was alive, none of these drugs were available. The beta blockers became widely available in 1972. And even then, you know, when I say widely available, it wasn't like every doc and his brother knew about them and was going to prescribe them. But and that was in a hospital setting. He died in 1975, and he was taking hydrochlorothiazide, and well, he was taking that as part of a combination drug with Aldomet, alpha-methyl-dopa, which is an alpha-2 agonist, but also has a bit of a intrinsic direct anti-hypertensive effect. But it turns out, and this wasn't known at the time, that's the alpha-2 agonist action centrally acting in the head, you know, in the central nervous system, that really accounts for most of its anti-hypertensive action. Now, it's a drug that burns a few bridges in terms of doing certain kinds of blood tests. And it's a drug, like all alpha-2 agonists, such as clonidine, that you cannot stop suddenly. You have to taper it down. That also wasn't quite known at the time. Well, that wasn't an issue with him because he didn't stop it. But before that, before you know, the Aldomet or alpha-methyl-dopa came out, and that didn't come out until sort of like 66, 67. He'd been tried on a number of things. Well, you know, short of some of these massive ganglionic blocking drugs in the 50s, and they weren't going to you just didn't get those outside of a hospital setting, or outside of being really, really, you know, like 200 over 140 sort of person, which he was not at that time. He was put on reserpine, which is it's reserpine, which it's a Rauwolfia alkaloid that it's centrally acting, and it does lower blood pressure. It indeed does lower blood pressure. But it also really messes you up. I mean, it causes severe depression, bizarre dreams, got a great deal of orthostatic hypotension with it. And he got to the point where he couldn't tolerate it. You know, he said, I'd lie there he had kind of a, you know, the chair or in bed or on the couch. So I'd lie there and I'd have these, you know, incredible nightmares, you know, bizarre nightmares. Now, beta blockers can give you nightmares, but not anything like what these Rauwolfia alkaloids did. So then, since he couldn't tolerate that, diazepam, Valium had just come out. And there's all this thing about, oh, you know, stress causes hypertension, and this, you know, stress doesn't cause hypertension, it makes it worse, but doesn't cause it. And, you know, he taught school, and anyway, so they gave him, his doc gave him, and his doc was working with him. His doc wasn't, you know, just blowing him off. 2 milligrams of Valium, 2 milligrams of diazepam. Now, I've never taken diazepam. I've used it in the operating room setting, you know, intravenously on patients, but he'd take this 2 milligrams of Valium, diazepam, and he said, I just pass out. Now, here's a man that had a fairly high tolerance for alcohol, but 2 milligrams of diazepam pretty much rendered him unfunctional. So that didn't work. And so then about that time, the alpha-methyl-dopa came out, and that's sort of what he used until he died. When he died, he had a jar of almost 750 of these things left. He had gotten the guy to prescribe him pretty much a 9-month supply. He took, it was like, he took a gram of it a day and 100 milligrams of hydrochlorothiazide a day, and it came in like 250 and 25 milligram tablets, combination tablets. And so a jar of 1,000 would last him 250 days, so about a 9-month supply. When he died, he had about a 7-month supply of that stuff left, but of course you can't return that stuff, and so we just had to pitch it. So that was about $300 down the drain. Well, anyway, last month of his life, his blood pressure was running 170 over 120 despite this treatment. His potassium was 1.7, which is incredibly low. Kind of made me think perhaps he had an aldosteronoma. But he had been evaluated for that, I think. So I was told when I talked with his doc afterwards. Anyway, he died. But what got me started on this story was when I saw him in overt heart failure in September, the year before he died. I'm sure I mentioned, I'd become very good friends with one of my history instructors. Well, a couple of my history instructors, but this particular history instructor, he was one of these guys who was hired for on a 3-year contract while he did his PhD, and then, well, he eventually did finish up his PhD, and he got his PhD and from another university, and while he was working at Ohio State, then he got hired on as an assistant professor down at a very new university in the northern part of Kentucky, which eventually he became, after many years, he became actually chairman of that department. But so he and his wife, and I had become good friends with them. I had babysat for their boy, their new baby, and then after they moved down to Kentucky, we kept in touch, and they came up and visited my parents, and my folks became relatively good friends with them, and they actually, then we'd go down and visit them, they'd go down and visit them, and they'd come up and visit us, and I actually kind of got a hair jealous. I mean, my folks always became better friends with them than I was. But Jeff and Catherine bought a place on a hill south of where he worked, and it had a hill that sloped down to some bottomland on a creek, and they'd planted a garden down there in the bottomland, which was very rich land because occasionally it flooded and so forth. And my dad was an avid gardener, as I'd said. I mean, I may have mentioned that. 3 to 5 acres of garden a year he put out. And so we'd gone down there for lunch, an afternoon, and we walked down the hill and saw this garden, and my dad and Jeff and Catherine were talking about all these plants and tips and things, and then it came time to walk back up the hill to lunch, and on the way up the hill, and it was a pretty steep hill, I myself got a bit breathless, and I was actually relatively decent. I mean, I was running at the time, and you know, I was down around 160 pounds, and I could run 6 miles and all that kind of stuff. And going up the hill, you know, I was getting just a little bit hair-winded, but not, you know, too bad. And we weren't going up all that fast. And my dad, I noticed, was actually, he actually was wanting to almost avert frank pulmonary edema. He didn't foam. He wasn't coughing up frothy sputum, that sort of thing. But he clearly was going into acute congestive heart failure there during the exertion of going up that hill. And it was because he was just so hypertensive, you know, just his blood pressure was running so high. And I remember thinking, well, you know, this might be it as far as the last fall and winter for my dad. And as it turned out, it was. Much as I decry Big Pharma for its pricing policies, I have no problem with Big Pharma trying to develop drugs that keep people alive. Well, I've got a couple more things to tell you about, but I'm not going to do that today. So I'm going to say bye-bye, YouTubers. All righty.